Hello, everyone. This is Cheryl Ann Bourne, publisher of My Bariatric Life, speaking today with Dr. Edward J. Domanskis on plastic surgery after massive weight loss. With the increase in bariatric surgeries performed and new treatments developed for obesity, quite understandably, there also has been an increase in plastic surgeries performed to remove excess skin and fat following massive weight loss. Unlike skin on a person who was only overweight, the skin does not recontour to the body after decades of morbid obesity in a person once this massive weight is lost. Exercise cannot shrink this skin. Rather, the skin and pockets of unattractive fat must be surgically removed and weakened abdominal muscles tightened so that the natural contours of the body may be revealed. In this regard, then, plastic surgery is often thought of as the completion of the weight loss journey. I am pleased to have Dr. Edward Domanskis with us today, who will offer his expert opinion on plastic surgery after massive weight loss. Dr. Domanskis is a board-certified plastic surgeon in private practice in Newport Beach, California. He's also an assistant clinical professor of plastic surgery at the University of California in Irvine. Dr. Domanskis is certified by the American Board of Plastic Surgery and is founder and president of the American Society of Bariatric Plastic Surgeons. For information on Dr. Domanskis' training and education, as well as the plastic surgeries he performs, including before and after photos of patients, please visit his website, surgery-plastic.com. Welcome, Dr. Domanskis.
Thanks, Cheryl. Nice to be with you today.
Thank you for sharing your time with our listeners today. When I was beginning my plastic surgery after massive weight loss, I did not understand just how much obesity had deformed my body. I was aware, of course, that obesity had been the cause of my former diabetes, hypertension, asthma, and GERD. And clearly, after my weight loss, I could see my ugly hanging abdominal apron and mons pubis, my deflated breast, and sagging inner thighs. But I learned as well the underlying structures of my body had been deformed. As just one example, my rib cage was very deep owing to my former obesity. Further, it was made clear to me that I was a much more challenging case than women seeking plastic surgery whom never had been morbidly obese. Add to that, I was more prone to complications during surgery and recovery owing to my former health conditions. So, bearing all that in mind, please help us to understand how you would sequence and combine procedures in a massive weight loss patient, keeping safety, aesthetics, and finances top of mind.
Well, I think that what I do, first of all, is I always sit down with the patient, whether it's on a personal consultation here in my office in Newport Beach or in Miami, or over FaceTime or Skype, and I, determine exactly what bothers them the most. There, as you mentioned, there's many procedures that a person can have done after a tremendous weight loss because they have hanging skin everywhere. Most of the patients I find are actually in very good health. They basically are on a vitamin regimen, and because of the fact that they no longer have the diabetes or the high blood pressure or the cardiac problems, they're in excellent condition. So, and on top of that, they're very motivated to have the surgery. So, we talk about what I can and can't do in different areas. I ask them to tell me what concerns them most on their bodies. In most cases, I find that it is the abdominal area, and also maybe the hanging skin of the arms and the thighs. And then we formulate a plan. Okay, in most cases, we do try to get the insurance companies to cover the particular patient's procedures, but it is quite difficult. As you know, the bariatric part of these procedures have been covered, especially since it was determined that it is a disease, even by Medicare, but the plastic surgery part of it is not covered. Now, some of these procedures are more likely to be covered, such as an abdominoplasty or lower body lift, and some of the procedures are less likely to be covered, such as a facelift or basically an armplasty or a brachioplasty. Once we determine then what may be covered, what can't be covered, Then we go ahead and try to pre-authorize it. Then we go ahead and submit these to the insurance carriers, and it takes a long time, a lot of times, for pre-authorization. Now, in the interim, these patients a lot of times won't want to wait for their procedures. They basically, will just go ahead and do that, and then in most cases, the plastic surgeons, in our case too, will probably give them a discount because it is then a cosmetic procedure, and we have an arrangement with the facility or the hospital in order to get a better rate for their particular procedure. And on top of that, we do have various payment plans that are available to the patient to go ahead and cover their procedure. So there's various avenues that we can go ahead and try to basically get the patient's procedures performed and done, so they can sort of finish their journey and get back to more normal life.
And so, would combining surgeries versus having, several plastic surgeries covering, one or two parts of the body, would combining surgeries into one or two bigger surgeries be a cost effective thing to do?
Yes, I'm a firm believer in combining procedures because basically not only are the costs less for the patient, the recovery is the same. In other words, the patient doesn't recover from each of those procedures separately. They recover, together, from those procedures. So what I do is I go ahead and see what the patient wants to have done, and I set myself a time limit. And in most cases, I say, okay, if I can do these procedures within a reasonable period of time, and by reasonable period of time, I mean probably 5 hours or so, then I'll go ahead and do that. Again, I think that by talking to these patients, by seeing what the motivation is, and most of my patients I find are very, very motivated to complete their journey. And what health status they're in. And most patients, again, I find that they're in very good health in most cases. Also, we go ahead and formulate a plan, and whether it be in the hospital as an outpatient, whether we're doing one procedure or three procedures. I mean, I've done on one particular patient, I've done a lower body lift or abdominoplasty, breasts, and an arm lift, or different combinations of those particular three. And I think it's better also in most cases to have a surgeon that is pretty expeditious in what he does. I mean, I fortunately am able to go ahead and do more than one procedure in a fairly limited period of time, and that has been found to actually decrease the problems after the surgery. So I think that that's really a key. Now, if a person or a plastic surgeon is going to be doing an operation, and one operation is going to take them 6 hours or 5 hours, then obviously you don't want to do more than that, because again, after a certain period of time, safety tends to be compromised. And I think that the number one thing that we always worry about, for me especially, is safety. So I think that again, we're individualizing on every particular patient. But to summarize it, I am a firm believer in combining procedures.